My name is Lisa Stalley-Green and I'm the Chief Nurse at University Hospitals Birmingham. And I'm going to talk a little bit about opportunities for careers in particularly nursing, but in the health service at this point in time. You'll have seen a lot of widely publicised images of nursing in the health service, certainly during COVID-19, and some of the roles that people have undertaken in terms of testing patients out in the community, looking after them in community settings, looking after them in emergency departments and in intensive care units where you'll have seen people almost fully covered with personal protective equipment. At the moment, nursing is particularly unusual in terms of the precautions that we're taking around infection prevention, and that does mean that we are wearing PPE. But a lot of the roles that we're doing in nursing, we are engaging with patients very positively, wearing masks and not having to wear that full set. And in terms of nursing as a means of engaging with and communicating with patients, understanding their needs and then meeting their needs when they're either suffering with an injury or an illness or poorly on an ongoing basis, that's fundamentally what we do as nurses. So we engage with people, we connect with them, we understand what it is we can do to help them, and then we look after them. I think that one of the things that you will have seen is the importance of the health service nationally and the importance of nursing within that. There comes a point when people are under probably the most stress or are feeling poorly or really challenged and worried about their families, that's when the health service really steps in. And there's a bit about we're the people that are there for people. Nursing either in hospitals or in the wider community, we're there for people 24/7. So a career in nursing can be really varied, and there is something about working within your community for people from your community at a time when they really need you. One of the things that I'd reflect on in terms of the future is how we're using technology more and more in hospitals and community settings, and that enables us to make really good decisions for patients' care, connect them in with other services that they might need, make sure that they get the medications that they need in a really timely and contemporary way. So nursing is these days feeling much more modern than perhaps some of the historical images that there are around the profession. We're doing well in Birmingham in terms of attracting people into nursing careers. So we have really good infrastructure in our hospitals and our community services for ongoing training of people coming into the profession. So that's student placements, but also then ongoing professional development for staff. So if you're the sort of person that likes to learn new things, likes to keep contemporary in your thinking, and really want to make a difference for other people, then I think the NHS is probably a really good place to be right now. There is something about once you've got your professional qualifications and keeping up to date on practice, not just are you making a difference for others, but it's I think one of the things I reflect on is the value that it gives to yourself as understanding that you have professional status within your community, you have qualifications and a reputation that is understood and valued worldwide. And for me, there's always something new to learn in nursing. So I've worked in many different settings with many different types of patients, and there's a bit about you can have a lifelong career in nursing and in the health service. Lots of nurses go on into management and leadership careers. Some become educators, some become researchers, and a lot move into specialist practice, so do higher degrees, higher qualifications, and work in specialties. So there are many things to keep you interested and stimulated over a long career. And one thing that I would say about nursing in the NHS now is there's really good job security, there's good professional development opportunities for people, and there is something about being part of a really valued, highly regarded profession whose reputation stays right there at the top in terms of public public regard. So I think for me, I came into nursing to make a difference. There isn't a day that goes by that I don't think I've achieved that. And the kind of the gift that it is to you to be able to help others, look after others, and play a really good part in terms of what's important to our communities, I think is second to none. So if you're thinking of joining the NHS, thinking of a career in nursing, I would absolutely recommend it. I'd recommend that you explore your thinking with other nurse colleagues and academic support staff around joining programmes. But absolutely would recommend Birmingham now as a place to join the NHS and become part of that family.